Welcome everyone to this panel, Trends and Risk Factors. My name is Chloe Casey. I'm a PhD student from Bournemouth University, and I'm also a member of SMaRteN's student research team. So I'm here just to introduce this session and to provide a student voice. So you might be thinking what we actually mean by trends and risk factors. So these can range from societal factors that we all experience, whether we like it or not, such as, political discourse, climate change, economic changes, and also person-specific factors. They could be debt, housing, sexuality, gender, inequality, or being an international student, or experiences of sexual assault or racism. So the discussions today really aim to explore what we currently know about these trends and risk factors of student mental health internationally, and to chat about research that starts to identify these sort of key experiences that leave students vulnerable to mental health problems. One reason SMaRteN was set up was to get better data on student mental health. If we knew more about the factors that were most risking students' mental health, universities could try to manage those risks and provide more support. So one of the benefits to being online this year is we're lucky enough to have two fantastic researchers from the US who join us this morning, Daniel and Randy. They can provide us a picture of the international data and how this can help us understand the issues facing students in the UK too. We also have the pleasure of being joined by Emma, who works on longitudinal student mental health data and how we measure risk. Eva, who can give us an overview of undergraduate student mental health, especially in Northern Ireland. And Katie, who's worked with SMaRteN to look at how postgraduate researchers have been impacted by COVID. We've got a fantastic range of views to hear from today, so please get involved in the discussion by sending in your questions in the chat. Anna and I from the student team are also hosting a spillover session at 5 p.m. So it'd be great if any of you wanted to stick around to join us for that, to keep the conversation going and have the opportunity to talk about other questions. But now I have the honour of introducing the wonderful Rosie Tressler, CEO of Student Minds. We're really lucky to have her here hosting the session because she's so passionate about student mental health and a keen supporter of the SMaRteN network. So welcome, Rosie.
Thank you so much, Chloe, and wow, it's so lovely to see so many faces. It's quite wintry here in Leeds, so wherever you are, whatever time it is, thank you for making time for this session. Just to kind of set the scene a little bit really, because I know my colleagues are going to start doing their introductions in the chat. I thought I'd just say a little bit about Student Minds for anyone who's new to us. So we are the UK student mental health charity. We grew very much out of student-led approaches to mental health, and that's why there's no better thing for me than following in, behind what Chloe is saying. There are a couple of things I wanted to draw people's attention to about this theme of trends and risk factors. So specifically to pull out the University Mental Health Charter as a useful resource. I won't speak about it today, but just to flag really, I guess we were trying to make sure that we were responding to key risk factors that we know impact students when we were developing that programme in the last couple of years. And also to highlight for people Student Space, which is the additional support we've been providing for students during the pandemic, where students can get support via phone, web chat, email, text, and access loads of psychoeducation, so guidance on key issues that they're experiencing during the pandemic, which will be all available to students throughout Christmas. So I just wanted to make you all aware of some of those things before we get started. But as Chloe says, I'm super passionate about this. I'm not a researcher myself. I fondly describe myself as a researcher ally because I'm always in awe of the work that all of you are doing. And yeah, really excited to hear more. I had the option to pre-meet the panelists, so I know that we've got some really interesting topics to get stuck into. In terms of how this is going to run, it's going to be just a couple of minutes initially from each panelist. We're going to open up some of their key areas of interest and the key topics that they've been grappling with, and then we will open it up more widely for this panel discussion, asking you to submit your questions. Please do so. I've got help to try and draw out questions behind the scenes as well. So do say hello if you haven't already into the chat box, and yeah, make use and share your questions. I also just wanted to highlight one other thing, which was just that I appreciate that a lot of us involved in this area have got our own personal experiences of mental health difficulties, and sometimes the subject matter can be quite intense depending on how we're feeling that day. Just to flag for people, if you are feeling distressed at all by this, we've got mental health first aiders on hand. So that's Laura, lovely Laura, and you can contact Laura Beswick via private message on the chat if you want to during this. And we're also sharing some support lines with you in the chat as well very shortly, so you can see some of those other services that you could utilise if you feel that would be useful to you during or after this session. Yeah, I think I've almost done all my housekeeping. I think just a couple of other little things. Just to highlight for you as well that there are some pre-recorded interviews and some talks with some of the panelists as well available on the SMaRteN website. So I think you'll get some of those links, or you've had it already through to you. And yeah, there's I think even a link going to go in the chat box for you now. If you have got Twitter or other types of social media, please do use the hashtag. It's hashtag SMaRteNConf. So yeah, I was having a look earlier at the discussions, and there was some really helpful resources being shared by both the speakers and the attendees. We want you to share your views and opinions on Twitter just as much as the panelists, so please do get involved with that chat. And just to be aware as well, because we are recording this, that anything that you do say would be included and could be included in this chat as well. Fab. I think that is most of it. So just remind you, this is recorded. You've seen the live button, so you will be being recorded by Andre, a lovely team at Mental Health. So this will be on YouTube, something you can draw on again in the future. And so I think I can now hand over to a colleague who's going to share an initial poll, because we love to kick things off with starting for a bit of participation. So I know for some of you in the UK it's towards the end of the day, but get comfy. If you haven't got a tea, you've got blankets, get as comfortable as you want to be. And we're going to ask you to take part in this initial poll, asking you about your role in relation to student mental health. So I'll just give you a moment to have a little look at the poll and take part in that. It's not too many options. I'm sure it's just looking at it thinking, who am I now? What am I doing? There we go. So we have got a real mix in this session, which is lovely. So more research than anything else, but a real variety of students, clinicians, lecturers, and the others. Big up the other category who don't want to be put in a box. Fair play. Good. Okay. So I'm going to crack on then with today's panel. Just to go over initially, I'm gonna come first of all to Emma. So you've had a little bit of intros already, but just a reminder. So Emma is a postdoctoral researcher at the University of Sheffield. So I know, and some of you might have seen as well, that Emma's involved with projects to do with BACP as well. So I'm going to come to Emma and ask you just to kick us off really with what you can share about data from counselling services, what that can tell us about recent trends in mental health, Emma, and maybe a little bit about how we actually measure risk and what the data does tell us. So over to you, Emma, for an intro.
Thanks, Rosie. So I'm going to take a really broad approach to this in terms of looking at trends. So even outside of research, I think it's quite widely reported that levels of psychological distress in students is rising, as is the demand for counselling. But it's quite a complicated picture, and there's a number of reasons as to why this might be. So as Rosie mentioned, most of the projects I work across Sheffield and BACP, but most of them look at data that comes from counselling services from universities. And what we find is that the number of students who approach counselling services does rise each year, but so does the number of students who come to university. And in the UK, we find the number of young people who approach NHS for psychological support, that's also rising. So to some extent, there's a broader trend here of young people approaching mental health services. What's interesting, however, is that it's not just the student numbers that are rising. So students are presenting with higher clinical needs than previous cohorts, and cases are more complex. And this basically means that students appear to be experiencing multiple issues with their mental health and are requiring longer term or specialist interventions to help with their mental health. In terms of how services measure risk, it's a complicated question, but the short answer is that there's no one way to do this, and there are many different measures, and that's part of the issue to make sense of the data, because especially in the UK, there's many different ways of doing this. It's also worth noticing, which some people outside the field might not know, but there are challenges to collecting good quality data in services, and this is partly because they don't necessarily have the right finances or infrastructure in place. So you might be surprised to hear that even today, there are some university counselling services that still use paper forms because they can't afford the licence fee, or they're waiting for some magical bespoke computer system to be rolled out across the university that they're still waiting for. But even this aside, even if there is sufficient resource, there are several clinical measures that a service could use to determine risk or mental health profiling more broadly. And many of them actually don't tap into the experiences we know to be unique to students. That being said, when we can look at data from counselling services, we find that anxiety and depression still dominate, but other trends are emerging. So 15 years ago, it was more common for students to go to counselling with concerns about their relationships. However, nowadays, we're more seeing instances of social anxiety or academic issues and employment concerns. Lastly, what doesn't the data tell us? Well, we only know about the students who walk through the door, and you might be surprised to hear this, but recent figures from this year state that approximately 50% of students actually don't disclose a mental health condition to the university, and the percentage of unmet need is estimated to be between 60 to 80% for students, and this percentage is different for different student groups. We also know that barriers for accessing support also remain, as does stigma. And this last point I wanted to make is that the fact that stigma still remains, this is quite an interesting point that I find interesting anyway, because today we have quite a number of awareness raising campaigns that are really trying to promote a positive culture around having conversations around mental health and seeking help. So I suppose I asked the question to the audience, why then are we still having stigma as being such an issue, and why are there still barriers for students to approach services? So in summary, mental health is nuanced and it's a very complicated picture. And although we've come quite far, I think we still have far to go.
Thank you very much, Emma. I think that's a really brilliant message to kick us off with, and already drawing out some of those key areas that we might come back to. Interesting, we started with factors like employment, and yeah, a reminder that stigma is still a part of people's experience. Brilliant. So we're now going to have an intro from Caoimhe. So Caoimhe Ward, who is a PhD researcher at Ulster University. And I know that Caoimhe's been involved with a World Health Organization study, which has involved a large mental health survey for first year undergraduate students. So Caoimhe, perhaps you can tell us a little bit about some of the trends that you've been seeing in mental health across the student population, and how you see COVID having an impact on student wellbeing.
Hi everyone. So my research is currently looking at the impact of the COVID-19 pandemic on the mental health of undergraduate students in Ulster University and Letterkenny Institute of Technology as part of a wider student psychological intervention trial. So I'm just going to give a little overview of the trial and what we have seen so far. So last year in September, the trial recruited 1,828 first year undergraduate students who took part in a mental health survey. And this year in October, these students took part in the same mental health survey, but this time we added additional questions which were specific to the COVID-19 pandemic. So ongoing restrictions, concerns about a second wave, job losses and reduction in social activities, as well as changes to how the courses are being run in universities, may have negative consequences on the mental health of students. So from these COVID-specific questions, we're starting to see high levels of mental health problems, self-harm and suicidal behaviours. The main stressors students have reported in relation to the pandemic were increased social isolation, concerns about loved ones or themselves getting infected. Over 2/3 of students indicated that their motivation towards their studies had reduced, and over 60% indicated that they felt anxious or that even their sleep was being disturbed. So the questionnaire is currently still opening open, and we're still getting a few responses in, but we don't expect the trends that we're seeing so far to change too much. And the findings from this study have provided such an insight into a way in which students have been negatively impacted by the pandemic, which may then have longer term consequences on their academic achievement and employability.
Brilliant. Thank you so much, Kiefer. And I think I probably speak for everyone in this call of how impressed we are with how quickly research communities pull together to answer some of these questions, especially as all of us have been reacting to the unfolding situation as well. Brilliant. So I'm sure we'll want to come back to this more in the discussion and the questions. So have a think if there's things that you want to know a bit more about, some of the data that Keith just mentioned there. Brill. So we are going to go over to Katie now. So Katie Tyrell, who is a research associate at the University of Suffolk, and also, you know, likes to occasionally chair the odd panel herself. So over to you, Katie. You're going to chat just a little bit more about the research on postgraduate students. So we know a lot of research that's out there is often focused on undergrads, but you've really shone a light on this experience for postgraduate students. So what trends and risk factors can we pick up about this group?
Thank you so much, Rosie. And it's so exciting to see so many people here today. Thank you for joining us. So I, as Rosie said, PhD students, PGRs, as I'll refer to them, can be quite overlooked at times, and despite there being, and I think Chloe spoke about this earlier in one of the earlier sessions, despite there being kind of over 100,000 PhD students at UK universities, they do get overlooked as a population themselves at times. So I worked alongside Nicola and a brilliant team of PhD students and early career researchers within SMaRteN, working alongside VTI to launch a nationwide survey looking at the impact of COVID-19 on PhD students and early career researchers. So as a PhD student myself as well, I found this really interesting, and it has been a very turbulent time for many people, but particularly PhD students, I would suggest. They're in a really awkward position where they're kind of bridging being a student and also negotiating different identities, being a member of staff as well. I think the work really highlights that COVID-19 has exacerbated issues that PhD students were kind of already tackling, I would say. But it's really highlighted the fact that there are multiple different risk factors within this group as well, which contribute towards mental distress. So things such as financial uncertainty, uncertainty around deadlines, but also the kind of precarious positions that early career researchers and PhD students are in, with fixed term funded positions and things like that. So in terms of particular characteristics and demographics, which were predictors of mental distress, we found that being a PhD student in comparison to early career researchers was a predictor. Also being female, having disability, being an international student, but also, probably not surprisingly, respondents who didn't feel supported by their supervisor, line manager or university, or those who felt there was a real lack of guidance from the institution were more likely to experience mental distress as well. We also found, and I will stop talking after this bit, that what was quite interesting was that there were certain factors which might mitigate some of these risks and work towards that kind of prevention of poor well-being as well. So amongst kind of more structural changes, there are really small things that universities can do and supervisors can do, like maintaining regular contact as well as listening, acknowledging, understanding the position of PhD students and providing opportunities to connect with others. And this is where researchers like Chloe is doing amazing work in this area as well. So when we think about risk factors as well, I think what I'd like to say is that we also need to think pragmatically as well and ask student groups themselves how we can put mechanisms in place to alleviate the chance of factors developing into mental ill health as well.
Thank you very much, Katie. And brilliant to, you know, so early on in this discussion have really zoned in on the differences between different members of the university community, and I'm sure we'll talk more about this. And pulling out that supervisor, I said survivor then, that's a bit of an interesting Freudian slip, isn't it? Supervisor relationship and how we build that sense of belonging. There's lots in there, fab. So we're now going to get on board our flight over to the US. I'm sorry, I will stop being so cringe as this goes on. But yes, we are going to hear now from Daniel and then from Randy about what some of their research teams have been working on. So to start, I guess with Daniel, based at the University of Michigan. You've been, I mean, lots of data I know that we've all looked at and findings that we've drawn on in the past. Although it is US specific, obviously there's so much we can learn from here in the UK. So Daniel, could you share some insights about what we can learn from the research that you've been doing, and perhaps your thoughts on some of the reasons behind the rising rates in students reporting distress? So over to you, Daniel.
Sure. Thank you very much for having me here. And I was at University of Michigan for many years, but now I'm at UCLA in California, so you'll have to lay over your flight in Michigan and then keep going another few hours. Also, apologies for the American accent. English accent so much more pleasing to listen to, but bear with me. I approached this, actually, my background's in economics, and I mention that because that's sort of how I think about, and I think a lot of people think about student mental health is that there's this opportunity to make really good investments in young people. And college or university settings offer that opportunity in many different ways, not just mental health services, but kind of more environmental factors, peer factors, all sorts of things, career-related factors. So that's where I'm coming from. And so we've been collecting data, survey data at a national level annually since 2007. And similar to what Emma described at the beginning, in the US, we're seeing significant increases pretty much every year, but especially since around 2012, 2013, increases in reports of depressive symptoms, anxiety symptoms, suicidal thoughts among university students at a national level. An approximate doubling, for example, of the prevalence of a positive screen for depression based on the PHQ-9 between 2012 and 2020. But you probably read some of the literature about why this is happening, and some of it may have to do with digital and social media. I think that's probably part of it, and also perhaps sleep quality, sleep amount among young people, which is related to media. But I also think it's important to keep in mind that while there have been some changes in recent years, there's some more fundamental factors that influence mental health that we all know about: access to services, social support, physical activity, even like diet and sleep, quality of relationships. So those types of things, I think we need to continue to focus on, just as we always have, while still trying to understand what's changed in recent years.
Brilliant. Thank you so much, Daniel. I know summarising all of that research since 2007 is not easy, I'm sure. So that's a really helpful overview. And again, I think there's something interesting here. I guess I'm curious if the audience might have some questions around digital or sleep or some of the areas we've picked up there as well. So keep them questions coming in the chat. Okay, so our final panelist to give an introduction, last but not least, over to Randy Aberbach, who is a professor at the University of Columbia, hopefully, because clearly my American geography is not going so well so far. So I guess one of the things that we were reflecting on when we were prepping for the panel was that it can feel all well and good knowing that trends that are there in student mental health and knowing about these risk factors, but why are we not kind of seeing the results? Why are we not getting better really at reducing student distress, and really starting to think about where universities should focus their efforts? So I suppose let's get stuck in with some of these big questions at this point, I think. So Randy, do you want to give us your initial take on this?
Sure, and thank you for having me. And I'm feeling very envious of Daniel because he's in Los Angeles, where it's probably a temperate 28 degrees Celsius, and we're about to get a foot of snow in New York. So he's quite the envy right now. You know, my background is as a clinical psychologist, and I'm fortunate to work in a consortium through the World Health Organization to investigate and better understand mental health as it relates to college students. And Our preliminary data, which is cross-national, and our initial reports included 8 countries, primarily high income countries, but more broadly now is including upwards of about 25 countries across 5 continents, across low, middle, and high income countries. And what's interesting, and I think in these data to consider, just taking a step back for a moment, are that rates are broadly consistent across countries of different incomes. And what we're seeing, broadly speaking, is that lifetime prevalence of mental disorders across these groups is about a third of students coming into college settings. And we know the age of onset of these issues typically is occurring in early to mid adolescence, and comorbidity is common. And I think it's particularly important to think about mental health as not just a single disorder, because I think that's actually the rare outcome for mental health. And I say that not because people are necessarily meeting criteria from a diagnostic perspective for several disorders at any given time, but they're certainly more commonly experiencing symptoms across dimensions and domains of symptoms. And it has a direct impact on their daily functioning, their interpersonal relationships, and most notably, we almost forget that they're in university, academic functioning, leading to greater rates of dropout, more likely to be put on leave, and also engaging in a wide variety of precocious behaviors, substance use, risky behavior, and is associated with high rates of suicide. And so this is kind of the doom and gloom of it. And I think it's important to start there only because we've known this for about 20 to 30 years. And I think that although we have known this for about 20 to 30 years, based on the data collected across universities in many different settings for many different reasons, it's almost reflexive to get stuck on things aren't better. And I guess I just want to take the counter position that I don't agree with that. That yes, these rates have remained unchanged, but our approach to this has changed quite significantly. So what do I mean by this? So firstly, I mean that we are articulating and better enumerating the types of disorders that people are having. Why is that important? We could provide more targeted outreach. If we know that a certain percentage of students are struggling with specific types of substance use disorders, we could have more targeted outreach. We have a better understanding of how that's impacting educational functioning. A good example of this in most university settings, there's an orientation before they even start a class, giving them and providing access to services, making students aware that there are these services on campus. And point in case, I think just by bringing this to the fore, making this a really important part of their introduction to university settings, we're by virtue of this reducing stigma. And I think broadly what we've seen, certainly not in every country, but in many, many countries, there's a stronger investment in peer support groups. I think Emma had mentioned this very early on in something that she discussed is that, in some of the data that she quoted, 50% of individuals who noted that they would benefit from mental health resources actually didn't pursue it. In our data, we see that it's as high as 80% of people who noted that they would benefit. And where do these students typically go if they're not using more traditional mental health care settings is peer support groups. And I think that institutions have invested in these peer support groups, particularly underrepresented groups who are more likely to pursue it. And I think, just two other thoughts along these lines is that we know that suicide rates are high and climbing, but we've done a better job in university settings, and we're not perfect, and I think there's still a lot of room to grow in terms of increasing awareness around it, making structural changes in terms of building fencing around bridges and things of that nature, having hotlines on campus. There's messaging that goes out from administration at different times of the year when there's known higher risks of when suicide might be more likely, around finals, holidays, periods of isolation, and so on and so forth. And there's increased access to service use. So a lot of mental health, a lot of universities and counseling groups with which we work actually increase their staffing around these high risk times. Again, showing kind of these dynamic adjustments to try to meet the needs of students within their university settings. And I think that they're trying to do this across different levels of care, whether this be in person, using phone, using app-based services, or again, just within their peer support groups. And so I think, we have a lot of room to grow in terms of improving mental health outcomes. And I think by looking at the data, it's very tempting to say that we're stuck. But I do think that there are tractable improvements that with targeted outreach and changes can continue to try to address this problem.
Thank you very much, Randy. I think that, again, there's a lot for us to think about here. I think just starting with that honest picture initially as well for us all, that reminder of where we are, and also pulling out, you know, that observation about where are students going for support, and you know, peer support is definitely an interesting area. People that are involved with student lives will know that's something that we've been involved with over the years, and working out, but when does it work and for who, and still definitely trying to crack some of that. So yeah, very, very helpful. And I just want to say a huge thank you to everyone so far for, I think if we were to stop there, we've already got some really rich contributions, but we are not stopping. We've got lots of questions coming in. I'm going to start with something which I think is coming up in the chat, but also I think maybe follows on quite nicely from some of the other panel discussions that have been going on across the SMaRteN conference as well. So it was off the back of something that Daniel said, so where you're recognising that doubling in depression, is there any possibility that part of this links to the use of more medical terms like depression and anxiety in popular language? So this is something I think we've heard from a few voices. Does this mean that we are relabeling everyday emotional experiences? You know, it's hard, isn't it? Because we don't want to trivialize, and yeah, these are complex conditions for a lot of people, and sometimes we use we're quite quick to use that language. So I guess I was interested in whether you see anything in that data. Maybe if we see if Daniel wants to come back on that first, but then see if anyone else has got a viewpoint on that, really around the language we use.
I'm sorry, you're posing that to me first, is that right?
If you'd like to, Daniel.
Oh yeah, sure. No, yeah, I think absolutely. First of all, I think it's almost impossible to answer that definitively with the research and data that we have, but I think it's just intuitive that has to be an important piece of what's going on, because one thing we know for sure is that young people are seeking services, as multiple panelists have already said. They're seeking services at higher rates than ever, and are therefore talking about mental health and services more than ever. And we see that just in our day-to-day lives. So it would be surprising if that didn't translate, at least to some extent, into how people answer the diagnostic screens. Although I don't think it's been proven one way or another. There's some data from the counseling centers, the Center for Collegiate Mental Health based at Penn State in the US, where I think they're sort of in agreement with what I'm saying. That said, I would also be surprised if that explains the entire doubling. So I think it's probably a combination of factors.
Thank you. And does anyone else have a view they want to contribute on this from the panel? I know Emma's getting a thumbs up on a paper that she was involved in this area as well. Anyone else?
Just whilst we're talking about language, I was going to talk about research that I wasn't related to, but a colleague of mine at Birkbeck University. In relation to language, they did a really good research project where they worked with non-service users, and specifically male students, because I think this thing with language is also about how can we speak to the students who don't engage with services. So is it how we're doing the campaigns? Is it how we're designing the posters, or the methods in which we're communicating with them? And it was a really interesting qualitative study where they first spoke with male students and said, what do you know about the mental health services available to you? And like most universities, you go into the toilets, there's posters on the back of the door, there's email reminders, there's websites, there's loads of stuff. And when they spoke to these men, they didn't know what the services were available to them. What they then did was they developed a campaign where they got the students to develop posters that would speak to them, different strategies, digital media, in terms of how they would feel a message would attract them to go talk about their mental health or go seek help for their mental health. When they then did a follow-up and surveyed a broader group of male students, they had some, I can send the examples of the posters if anyone's interested, but it was incredible the amount of male students who were all of a sudden stopping in the street saying, oh, actually, yeah, I recognise that poster, that encourages me to talk about my mental health. So I think when we think about language, it's not only in terms of data and how we measure it, but also in terms of how we develop resources with students to speak to the students who aren't coming through the door.
Thanks, Emma, that's really helpful. And any other colleagues who want to jump in, just wave at me or feel free to come off mute. Otherwise, I can take us on to a next question. Okay, I think carrying on. So I guess I wanted to come back to I guess framing some of this debate. So we talked quite a bit about trends, about data that you're all working with, some of the patterns that you're seeing. Could we perhaps share some reflections? And I think there might have been a couple mentioned in the chat as well. Some examples of universities that we can see are using this kind of data to change the way that they do things at the moment. I don't know if people have got any other examples they want to highlight here.
I can chip in there, Rosie, if you like.
Go for it, Katie.
I attended an event not that long ago on behalf of the SMaRteN team, and they were professionals working within the higher education sector, and they were supporting PhD students, so it's professionals working alongside PhD students within kind of graduate schools and things like that. And I was talking to them about the research I mentioned earlier around PhD students and COVID and the impacts upon them. And a couple of things came up about what universities were doing in response to this. So I think it was really key that universities actually think about how this has impacted PhD students, and they were incorporating this into vivas. They were thinking about extensions to programs and fee reductions and things like that. So I think that from the kind of work that people on the panel are producing, we can get some really useful impact within the sector. And I just wanted to raise that, as I thought it was quite interesting how universities are responding quite innovatively to the kinds of the influence of the current pandemic on the lives of PhD students. I think there's still a lot more to be done, but I think universities are making quite positive steps in responding to things like that.
Thanks, Katie. That's a really helpful example. Maybe to take one more, if there's any other examples that we can share, because I suppose part of what's really exciting about SMaRteN is this, how we're trying to see how this can shape the practice. So anyone else got another example that we could point to here that might be helpful on the panel?
One of the things that I think is very tempting is to kind of pass the buck to social media and say, you know, given their reliance on social media, it's contributing to problems A, B, and C. But at the case level, those data just don't add up. And I'll tell you why I think that that's challenging. There's been a fair number of patients, particularly in underrepresented communities, who, depending on where they lived, have used social media as a lifeline. Connecting them with LGBT groups, connecting them with other underrepresented individuals, connecting them with different students who've experienced similar problems that they have in the face of a lot of similar adversities. And I think, you know, social media is a little bit like dessert. Too much of it is a bad thing, to be sure, but what's kind of that fine line in terms of the tipping point? I don't think anyone really knows for sure. And I think it's a real challenge for us to kind of institute what we think is the fine line, given that we're also asking them to rely on technology more and more and more, you know, particularly now during a pandemic. And I think that this has kind of opened the door for what will almost certainly be a new normal in terms of psychotherapeutic outreach, of being kind of more common on Zoom or other web-based fora, and things of that nature. You know, I think it's also a little bit kind of like the horse is out of the barn already, right? So, you know, social media is out there, you know, and we're not going to cull it just because we say it's a bad thing. And so I think, you know, rather than trying to name it as bad, you know, we can work with it and integrate new kind of innovative solutions that kind of work for students, and kind of provide some degree of education around, you know, what are good or bad usages of it. Much like, you know, a lot of parents of younger children who are getting smartphone access earlier in their age course, you know, at 9, 10, 11 years old, you know, they're not just handed a phone in most cases anymore. You know, there's some degree of education around it and kind of moderation around it. And I think part of our challenge now is that for this age group who kind of grew up with this technology in their hands, it's really hard to institute policy. I think we're better positioned now to work with some of the younger individuals coming up with this to try to teach them safer ways to manage their devices in the same way we teach safer way to drive cars with seatbelts and not drinking and things of that nature.
Mm-hmm. Thank you. So I think that's pulled quite a lot out about digital, and I think there's some lovely comments coming through on the chat as well. I think Amy's hello Amy. Something useful here about recognizing that this is a tool, and the power of spending time curating what you engage with yourself. I think that's a really helpful reminder, and a nice note from Andre about a blog on the National Health Service. Definitely always a good blog to read, so to check out that one on social media if you're interested in this topic as well. So I think we've kind of zoomed in a little bit on a particular theme that's definitely, it's been in the media a lot for sure. It's the sort of question that we get asked by journalists all the time. So you've just helped us get a more nuanced view of that between you panelists. I've had a few questions come in which relate to how much we can actually learn from different from findings from other countries to here in the UK. So how transferable actually some of those findings are? Do we actually, how would we select those countries? How much should we be considering the cultural context? So I think it's a really interesting question, and a few people have asked it, so we ought to open it up. And I guess I'd maybe be interested as well, I think that's something we can see even in the UK, that between the different nations where we have, devolved decision making, and again, very different cultures, even between Leeds and London, very potentially different experiences. So would anyone like to kick us off on this one? Perhaps if we start with people who are UK based, of your thoughts on this, and then see what US colleagues think. I don't know if Kiefer, if you've got a view on this, being based at Ulster at all, and when you draw on this kind of research from the nations as well. I see Kiefer somewhere.
She may be having a bit of IT issues. Her
camera. Sure. So apologies, Keith. I think we are a few of us are having the odd technical difficulty, but we'll come back to you. Anyone else want to reflect on this one? I'm wondering, perhaps Emma, if there's anything, if you've got a view on this from the work that you've been doing, also different health systems across countries as well.
So I can talk a little bit about the UK. I think Daniel mentioned a bit earlier about the CCMH over in Penn State. And I must say that one of the projects I work on sort of use that as the vision. So I think one of the benefits of looking to larger countries, or countries where they just have a different cultural setup, or perhaps a different acceptability for talking about mental health, it can be really aspirational, and it's a good way for us to pitch our ideas. So one of the things we've done looking at UK counselling data, because we use one of the measures, it's a student-specific measure that's developed by the CCMH group, it's an American measure. We've been able to benchmark UK data using an American measure against the American data. And what we find is that when you assess the measure in terms of whether it's valid to be used in the UK, we find it's quite a robust measure it seems perfectly acceptable to use in the UK. And we can replicate a lot of what the original developers of the measure have published. What's interesting is that when you then profile and look to see within the measure, okay, what are the students' level of academic distress, what's their level of social anxiety, we find that it's something about UK students that consistently, we've done quite a few studies now, maybe 4 or 5 or 6 studies, where something about UK students, they are consistently coming out as higher scoring than US. Now, we don't think this is because UK students have bigger issues. We think this is to do with the time at which they approach services. So we think that UK students perhaps delay approaching services. When we've done qualitative work with them, they say they're aware of the rates of suicide in the media, they're aware of a friend who was going through a difficult time, and they regularly say, well, I might be experiencing these issues, so I might not be able to leave the house because I'm that anxious, but my mental health isn't as bad as them, so I don't need help. And there's a theory that we're developing that we think that perhaps students in the UK, because it's not as acceptable to talk about receiving therapy or whatever in UK compared to some other countries, perhaps they do delay going to the counselling service, and that might be why we're seeing slightly higher rates in the UK. If we engage with them earlier, or if we could combat some of those conversations, then they might seek help earlier and we can do more about it.
Thanks, Emma. Brilliant. And I'm going to go to Daniel and then Randy for a brief take on this as well. Daniel.
Well, I mean, our data is almost entirely from the US. I have to admit, we fielded our survey in Ecuador, Mexico, and Qatar, and but just one university in each of those places, so I can't really generalize. So actually, I'm going to cede my time to Randy because he's got the cross-national comparisons.
So collaborative. Randy.
I think, forgive me for repeating, I think, we're finding remarkably similar rates across countries. I think one of the major differences, and you'll have to forgive me, I'm not totally sure how the survey is conducted, but it also depends on how you're conducting it, where you're conducting it, and when you're conducting it. And we're finding this out in different ways. And so what that means is, if you're collecting surveys from kind of counseling centers, almost by default, your rates are going to be a little higher because it's a treatment-seeking population. A lot of our surveys are often at the start of a school year or the beginning of a semester. But as you know, kind of there's this very predictable trend of mental disorder rates as you approach midway points through semester for midterms, and also the end of the semester finals. The problem, of course, in administering surveys during those times is that because students are so overwhelmed and busy, they don't do them. But in some ways, depending on when these surveys are administered, you're actually capturing different snapshots of their life, which are kind of predictable in some ways. And so I think, we are always guests in terms of university settings to administer these broad-based surveys, and we kind of have our ideal in mind, but we also have the pragmatic, meaning if they say this is when you could do it, we say okay. Interestingly though, Daniel Vigo at the University of British Columbia is actually doing a random sampling survey of 500 students. Surveys are going out every month, actually, 500 per year, so first through fourth year, every month, to see if they can kind of capture those trends. And so it may speak to perhaps why Emma's rates may be a little bit higher than the rates we're capturing, potentially. I don't know the study well. But I think broadly speaking, we're not seeing differences across country, but what we are probably going to see is a difference as a function of when.
That's really helpful, and I know quite a lot to that question. So hopefully that's answered what a few people were curious about, and we'll have to look out for some of those studies and share those through this network as well. Thank you, everyone. What I'd love it is to end on is to invite all of you, panelists and attendees, to use the chat function to share one takeaway or one thing that you'd really like to see the sector doing off the back of this discussion on risks and trends. But it's been a brilliant discussion. A huge thank you to our panelists, Randy, Emma, Daniel, Katie, Kiefer, you're amazing. And also to all the SMaRteN team, Laura, Nicola, Anna, Chloe, everybody, and Andre and Daphne for making this run so smoothly. But do stick around because Chloe and Anna, I think, are going to now facilitate a bit of a spillover session in small breakout rooms. And yeah, we will start to wrap up and end the recording very soon. But please do use the chat. Also use Twitter. If you've had a question that hasn't been answered, start a discussion, start that chat as well on the hashtag. But yeah, thank you so much, everyone, and I hope to see you at another SMaRteN event or something else in the student mental health world very soon. Look after yourselves over Christmas. You all done a cracking job and you all deserve a good break.